Okay. Oh, Yersinia, has anyone registered to make comments for the special call Board of Managers meeting?
No, Chair Bell, we do not have anyone signed up to speak for this portion.
All right. Thank you so much, Yersinia. I appreciate it. All right. We will now proceed to the regular agenda. Agenda item number 1 is to receive and discuss the results of the evaluation of the Central Health President and CEO. I announce at this point in time that we are convening in closed session to discuss agenda item number 1 and 3 under the Texas Government Code, Section 551.074, Personnel Matters, and agenda item 2 under the Texas Government Code, Section 551.074, Personal Matters, and the Texas Government Code, Section 551.071, Consultation with Attorney. So let me read the other 2 agenda items. Agenda item number 2, discuss and take appropriate action on the following. The A, annual performance evaluation of the Central Health President and CEO for the period of June 2021 to October 2022. B, any consideration on merit increase. And C, the employment contract of the President and CEO. And agenda item number 3, discuss the timeline for the development and approval of the fiscal year 2023 performance evaluation tool for the Central Health President and CEO. The time is 3:09, and again, it is where am I? October the 6th, 2022. Thank you. Got it. Okay, thank you very much, folks. We are out of closed session and back in open. It is October the 26th, and it is currently 5:01 p.m. Welcome, Manager Greenberg. Glad to have you here. We had discussion in closed session with regard to agenda items 1, 2, and 3. I would like to accept a motion on item 2B and C. Manager Musaitis.
Yes. I move that the board approve a salary increase of 3% for the president and CEO and renew the employment contract with the president and CEO for a period from November 1st, 2022 through October 31st, 2023.
I second.
I have a motion from Manager Musaitis. I have a second from Manager Brinson. Any further discussion? Manager Musaitis?
Well, I just want to thank Mr. Mike Giesland for his service and work that he has done for the past, I don't know how many years. 5.5 years, but incredibly for the past couple of years during really a global health, public health pandemic that really affected everyone's lives throughout the world. We thank you for everything that you have done, for the meaningful work, and for saving people's lives. Thank you.
Thank you. I'd also like to take the privilege to thank you, Mike, for everything you've done for this organization. As I've told you many times, you have made a difference. And you've made a difference not only for the people that we serve, but for Travis County as a whole. And for that, we are most appreciative. So thank you very much. Manager Greenberg?
Yes, I would simply like to add that having been chair during 2 years of the COVID pandemic, I can tell you that Mike Giesland probably never slept and never took time off. He was and is single-mindedly devoted to the health and welfare of those in this community who need the help the most, and we thank you for that.
Hearing no further discussions, I'd like to call the question. All in favor of the motion, say aye.
Aye.
Any opposed? Any abstaining? I have one abstaining from Manager Valadez. Motion carries. Thank you very much,
Thank you,
Mr. Giesler.
Thank you for the very kind comments and the process.
Turn your mic on.
Members, I want to thank you for the process and the generosity and the very kind comments and for allowing me to continue to work for those who need health care the most for another year. That means a lot. And Manager Greenberg, I will say, please don't look at my time card because I am taking some time off now.
Good.
Having said that, nonetheless, you all, it's just been an incredible, and I look forward to introducing the team here at the next agenda item.
Thank you, sir. Okay, that being the only action that we will be taking today, at this time, I'm ready to accept a motion for adjournment.
Jerry,
Yes, ma'am. I move adjournment.
a second.
I have a motion from Manager Greenberg. I have a second from Manager Valadez. Any further discussion? Hearing none. All in favor?
Aye.
Any opposed? Any abstaining? We are adjourned. Thank you, members. Okay, I will go directly into our board meeting because we do not have a quorum for an executive committee meeting. So, yes, we do. I should have asked David
I was
instead
gonna
of
say, that's
relying on my ability to count. Thank you, David. I appreciate that. Okay, let me pull up my script here for a sec. Okay, good evening. Today is October 26, 2022, and it is 5:06 p.m. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. Our first item of business is public communication. We will receive public communication for both the Executive Committee and the Board of Managers meeting before we proceed to the Executive Committee meeting. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 3:30 p.m. today. Before we begin, I'd like to clarify that if you intend to make comments on the LPPF public hearing, that will be later in the agenda. So please hold your comments until that hearing is announced. Yersinia, did anyone register to make public comments on issues other than the LPPF?
Yes, Chair Bell, we have one member of the public signed up.
Great.
I will now read I will now read the guidelines for this meeting's public communication. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when the speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comment before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. We received one submission for public comment for the Board of Managers meeting via the online portal. I will now call on our speaker, Jeronimo Rodriguez. Please unmute.
Good evening.
Uh-oh. Reese, he froze. Oh, no.
Can I start?
Are you going to testify for the LPPF, Geronimo? Or?
Yes, sir. Yes, sir.
Okay. That should be done at our hearing. So it will be after this public comment. So we will convene a hearing and then we will hear your comment.
Okay.
Okay? Thank you so much.
Apologies.
Anyone else, Yersinia?
That is the only one.
That's the only one. Thank you very much. I appreciate it. We will now proceed to the Executive Committee agenda. Agenda item number 1, approve the minutes of the Central Health Executive Committee September 7th, 2022 meeting. Manager Valadez.
I move the committee approve the minutes of the Central Health Executive Committee meeting for September 7th, 2022. I second.
I have a motion by Manager Valadez. I have a second by Manager Brinson. Any further comment? Hearing none. All in favor? Aye. Any opposed? Any abstaining? Motion carries. Agenda item number 2, receive and provide direction to staff on the prioritization and tentative scheduling of items for consideration at future Central Health Board and committee meetings. Perla Cavazos and Brianna Yanis will be presenting.
Thank you. So I'll briefly go over the November tentative schedules. For strategic planning, we have that meeting on November 9th. Currently, we only have one item, a preview of the demographic report. And then our executive committee meeting will be on November 16th. We will have our standing tentative schedules, approve the calendar year 2023 meeting dates, and then present Community Care Board of Directors and Sendero Board of Directors nominations with bios and a brief summary of meeting with candidate, and then recommend a treasurer for the Central Health Board. And then at the Board of Managers meeting on that same day, we will have minutes, investments, and then approve the treasurer for the Central Health Board, October financials, Sendero budget approval, a hub update, and approve the calendar, the 2023 meeting dates, and then the CEO evaluation tool for fiscal year 23, and then we'll have a partnership update where we will also discuss waitlist comparisons. And that's all I have.
Thank you, Brianna. Perla, any addition? Members, I just want to explain too that Manager Zuniga will not seek reappointment to the board, as Manager Zuniga is our treasurer. The item for November will be to announce the process of electing a new treasurer to replace her. Her term ends December the 31st of 2022. Okay. And also, our manager Greenberg is going to leave us on December 31st, and we will miss you for sure. And thank you for all of the service you've given us, and hope you stay close in case we have questions or need some of your sage advice.
I will certainly, it's been a great honor to serve and a great privilege, and those who we serve are near and dear to my heart, as are all of you. I've lived in the same house forever, so I'm not going anywhere.
Good to hear. Good to hear. Manager Valadez.
I wanted to ask a question, Bella or Brianna. When will we be seeing an update on our staff demographics? And this meeting? Well, I missed it on the agenda. Thank you.
Okay. Thank you very much. Agenda item number 3 is to discuss and take appropriate action on the reappointment of Mrs. Betty DeLargy and Mr. Juan Garza to the Sendero Health Plans Board of Directors. Brianna Yanis will be presenting.
We have provided bios and resumes for both of them in the board packet. Mr. Juan Garza served on the Sendero Board of Directors since 2014, and Ms. Betty DeLargy has served since 2021, and they are both seeking reappointment for a 2-year term.
Thank you, Brianna. As a member of the Sendero Health Plan Board, these two members have been extremely valuable in bringing input from different points of view and in helping us move Sendero to a point that it is currently sustainable and helpful in looking at ways in which we can strengthen the financial assets of the Sendero Health Plan. So I would like to take a motion first before any questions or discussions. Manager Brinson?
I move that the committee recommend that the board approve the reappointment of Mr. Juan Garza and Ms. Betty
Apologize. I move that the committee recommend that the board approve the reappointment of Mr. Juan Garza and Ms. Betty DeLargy to the Sendero Health Plans Board of Directors for another 2-year term.
Thank you. Do I have a second? Manager Motwani?
It should be a member of the executive.
Oh, I'm sorry.
Oh, sorry about that.
Do I
I'll
have a
second it.
Okay. I have a motion by Manager Brinson. I have a second by Manager Valadez. Any discussion? Manager Musaitis.
Okay. Yeah, it's working. Sorry. I see Mr. Juan Garza here. Can I ask him a question?
Aquí what?
Would you like to answer a question, Mr. Garza? You need to go over to seat in the hot seat here.
Well, first of all, thank you for your service and dedication to our community and the task and what you've been doing for the past almost 7 years on the Sendero Health Board. Now, my question to you, you've been on this board for many years now, and there are also, I wanted to know why you want to continue on serving, and also I see there's 2 reappointments for the future. And what, from your view, do you feel this Sendero board is missing in terms of skill set for us to consider for future recommendations?
Would you repeat that? I'm sorry.
Oh, can you hear me?
Yes.
So why do you want to continue on serving the Sendero Health Board? And just helpful. And 2, the second question, there are going to be 2 other nominations. What skill set do you feel that Sendero Board is missing that we should look into it when we're considering appointments? That's it. Thank you.
I like the idea of being involved in somehow providing health care to others. I was involved in early in my life in forming an insurance company up in Chicago called North Care, which is eventually bought by Blue Cross of Rockford. So I've been involved in this all my life. The idea that we can bring affordable insurance to folks who can barely afford to do it and probably can't is of great interest to me. I think that my sense is that the board is always assisted by having folks who have been in some executive capacity elsewhere, who understand the functions of an executive. Even though they're limited, everyone is extremely important. For example, setting the right tone. Only the chief executive sets that tone. If he works hard, everybody works hard. If he's there early, everybody's there early. If he's honest, everybody's honest. That's probably the most important thing an executive does. And I think it's important to have folks on the board that understand that those are very important factors in a board of directors.
Thank you, sir, for your service.
You're quite welcome. My pleasure.
Okay, hearing no further discussion, I'll call the question. Oh, I'm sorry, Manager Jones.
I didn't have a question for any particular board member, but I was wondering the frequency from which we get feedback on from the Sendero board from our appointees. Do we have any criteria that we build into that in our appointment? In other words, by our appointing, we're asking our representatives to report back on a certain frequency. Is that something that we want to consider in making those recommendations?
You can consider that as a part of the process, but I don't think that we have any policy or any procedure that does that. Mr. Giesen?
We do provide quarterly reports, and that's typically in paper form, but then from time to time, I mean, you have executive and board members as well that have come in and to provide.
What I was asking for is, do we ask the board members or that we appoint to come back and present before the board of activities, progress, those type of things?
Understood, and I'm sorry that I wasn't clear in prefacing the response, but in order to get the information about the organizations, that's what we've done in the past. I think in terms of having specific board member feedback, and those dialogues. It has happened on an ad hoc basis from time to time, usually driven by a particular situation or set of circumstances, but not on a regular basis. And that's the purview of the board to decide as you all set up your agendas what you would like those reports to be.
David?
Was it a
Is it-
procedural question?
Offer
or-
a clarification
Okay.
to your
Okay.
question, which is item number 4, is a presentation on the appointments process for the governing boards of Sendero and Community Care. It seems like this would be as
More appropriate in that
correct.
discussion.
And I'm not saying it's not appropriate for this as well, but that seems like an overarching appointments and interplay.
Okay, I can defer it to then. Thank you.
Manager Valadon?
And this may be also better suited in that agenda item, but my question is whether or not the Sendero Board has any provision for a specific number of community members to be appointed to its board, and whether or not there's an allowance for modifying the bylaws or adding that to the bylaws so that we know, since it is a member-based, community member-based plan for having representation from them. I'm just trying to make sure that we can codify that or put that in policy form. Mike, or Dr. Bell, you're the
Mike,
chair.
did you want to speak to that?
I'll defer, Mr. Chair.
Please add. My understanding of board members with regard to health plans, all right, and their fiduciary responsibility, there are some requirements by the regulator, Texas Department of Insurance, with regard to the individuals that can be a part of a health plans board. Do I know them by heart? No, I don't. But I think before we would make any type of change or recommendation on that matter, that we would consider legal research to determine, to make sure that individuals that we would consider adding to the board would be adhering to any regulatory issues that we needed to follow.
The reason I asked that, sir, for clarification purposes, is because I noticed that Mr. Eddie Southern and Carl Ritchie
Yes,
are not Central Health staff members or board members.
that's correct.
But I look at them as being representative, just like Betty, to the community. And I was wondering whether or not anybody else did. Do they themselves consider themselves in that regard? And if they do or don't, just curious. But if not, if there's an opportunity for us as a Central Health Board to talk about that, since we created Sendero, if that can be put on as a future agenda item also, and maybe an item to be discussed with the Travis County Commissioners and Sendero when we have our quarterly meeting with them.
And one thing to say about Betty and Eddie and
Carl
Ritchie, they all have had significant experience in dealing with insurance plans, and have gone through. There is a process of being fingerprinted, et cetera, that you have to go through to be a part of a health plan board. So those types of things have been done. They represent the community. I was hearing you say that the community meant patients or members, and that's what I don't know about.
Well, that's also a consideration.
Okay. Thank you. Manager Montgomery.
Thanks, Chair. My comment is mainly just a point of clarification around what a community member is, and if being a board member of Central Health disqualifies one from counting as a community member, because I feel like I'm a community member, and one who shops. Was actually had to make a decision whether or not I was going to decide go with Sendero or another plan, and so just wanted to put that out there. I don't need a response to it. Thanks.
Thank you, Amit. And being on the board myself, I do feel that I'm a community member too, in the fact that I do understand the issues and the needs of Travis County community with regard to their health care. And I think that in my time on the Sendero board, my support of that community plan has been unwavering. But I know that many of the times that the decisions that I think with regard to taking on certain responsibilities by a small plan that doesn't have much capital um, did not hold well with some individuals. But, that's just a difference of opinion and also insight from some of my experience in dealing with health plans when I was at the Health and Human Services Commission. So I'm not saying that you should agree with me, but I don't think that my difference of opinion sort of negates my desire to help the community and represent the community going forward. Okay.
I would like to know if Mike had something additional to add.
Oh, Mike, I'm sorry.
Nothing further. Thank you.
Thank you.
Okay. Hearing no further discussion, I'd like to call the question for the executive committee. All in favor? I have 1, 2 in favor. Any opposed? Any abstaining?
Oh,
You have to do
I
one.
have to vote.
Yeah, you have to do one of them.
No, I vote yay.
Yay, okay. So it's unanimous. The motion passes. Mr. Garza and Ms. DeLargy have been reappointed. Thank you, members. Oh, we'll recommend, I'm sorry. I'm getting confused with all these board meetings.
I know.
The motion was to recommend to the full board for approval of reappointment of Juan Garza and Ms. Betty DeLargy. It has been approved that we will recommend to the full board the approval of those reappointments for another 2-year term. Thank you, David. Okay, agenda item number 4 is to receive a presentation and discuss the appointment process for the governing boards of Sendero Health Plan and Community Care Health Centers. Members, we just did a reappointment to the Sendero board, but there are 2 vacancies. Those vacancies will be created by Mr. Ritchie and Mr. Sothert, who Manager Valadez brought up earlier. And for our new appointments, we would like to follow our established process of adding new appointments. You have a memo in your packet on page 21 that outlines the timeline that we have put out for this review of process. We had a call for nominations on September 2nd. October 12th was the deadlines to submit nominations to Mike and Perla. October 26th, the staff will review and updated timelines for interview process with the managers. Before our November meeting, myself and staff will meet with each of the nominee to determine interest and qualifications. That meeting is really to outline to the interested parties time commitments, meeting dates, usual meeting dates, and answer any of their questions with regard to the organization. I might expect that some of that discussion might discourage members from wanting to be in the nomination pool. And if so, we would surely take that into consideration. Those that would like to be further considered will come before the executive committee, and we will meet with those candidates and have questions and a dialogue with regard to their responsibilities and their commitment to being a board member. Shannon, did you want to bring up did you want to add to this process as we talk to the members? We can sort of outline that there is a commitment to come back to the board at some period of time to report. I mean, that's.
Yeah, what I'd like to say is that, given the status of our healthcare district being one of a enterprise as opposed to a single district, and that we operate via our partners, I think it's important whenever we make an appointment to a board that board or those board members do two things. One, emphasize the partnership and engage in that process, that they understand that they're carrying to the other agencies our expectations, because that's the purpose of the appointment. The second thing is to help the other organizations understand that we as partners are looking at, or from my perspective, we as an agency, as an entity, is looking at how do we enhance the current district that we currently have. And I think that a lot of the citizens of Austin and Travis County are not aware of the current healthcare district we have. I think it's important that we, as a district, educate and inform them that our district is different than the others in the state. And certainly as our partners, both Community Care and Sendero, it's important that that information and encouragement goes forth. So I put that on the table so that as we appoint nominees, that they, if the board agrees, carry that message to those partners as we go forth.
And our questions, we've sort of developed a list of questions that the executive committee will present to the members that are the nominees that come before us. Many of those outline a lot of that information that you're talking about. I think what it doesn't do is sort of go further to say that, these are messages that we want you to carry forward. And how would you carry forward those messages? But that can surely be added as we talk about that.
Well, thanks very much. And I think that's important because, as one who's been emphasizing this district take on the role of really a healthcare district, that our partners play a critical role in that, and that we can't just ask them to do it. We must encourage them to do it and monitor that it is being done so that we can rest assured that our charge and appointment occurs. So that's the point I want to make. Otherwise, we'll find ourselves 5 years hence, citizens still not understanding what the Central Health is as an enterprise organization.
Thank you, Manager Jones. I also want to clarify, I see the two hands over here, but I also want to clarify there is a vacancy at Community Care on their board, and those individuals will be going through the same process. Manager Motawani.
I really appreciate what Manager Jones is sharing, and I think I think there are like a lot of angles on how we flesh that out, because of course Sendero as an entity comes back to report to the Central Health Board either by means of CEO or board chair or whichever sort of conduit to the organization might come back and report, or perhaps share out on an agenda item or point of action. And that being said, nonetheless, just the notion that the enterprise appoints board members, or rather board managers of the Central Health enterprise itself to the Sendero entity, I do see that there could be some value in synergy, and also just creating that unity, so we're not like, this is Central Health and that's Sendero, and Central Health is controlling things, when obviously we're all Central Health, right? And so perhaps it could be like a work group type report out that just occurs, so we get into that pace of, okay, this is maybe not representative of the Sendero entity at large, but it is representative of the board members of the enterprise who sit on the of Central Health, who sit on the Sendero board, who can share that through their lens with their peers, our peers, I should say, here on this board, so that we strengthen that synergy, and the lens of those board members may also get to be influenced through shared decision making. And so, however that iterates, I'm really interested in seeing it.
Okay, Manager Musaiti.
Thank you. I'm just curious, with those two individuals that we need to replace, did their term end or did they resign? What's the reason for them leaving the board? And also the community care resigned, was that a reason? I'm just curious the reasoning why these individuals are
On the community,
circling up. Yeah.
on the community care health centers nomination or members, Ms. Pilar Sanchez recently resigned, and so we need to replace her. That's one.
Correct.
On community care. On Sendero Health Plans.
Yes.
Mr. Ritchie, Carl Ritchie's term is up, and he asked not to be reappointed.
Okay.
And then on
Sutter.
Mr. Sothard, Eddie Sothard, he would like to resign.
Okay.
Manager Greenberg.
Thank you.
I got it. And also, Pilar Sanchez is now the Director of Health and Human Services at Travis County.
Okay, thank you. No, just out of curiosity.
That was a position she took a few months ago, but
Yeah.
yes, she is now Director of Health and Human Services at Travis County.
Great appointment.
Thanks, Manager Greenberg. Manager Valadez.
Okay, so what I'm reading here is, I have and she is a good friend, but she's not anybody who would necessarily be able to be controlled by me, let me tell you. But she's an expert candidate for the Sendero Board, and I submitted her name, and I'm just realizing here that there was a deadline of October 12th. I would like to know whether or not I can make a motion to extend the deadline to include Gloria Leal's application.
I would say just send the information to either Perla or Mike, and we will add them to the
I
list.
sent it to you, Mike. I do appreciate that. Thank you. And I still am serious about having a conversation about whether or not we can look at the Sendero Board, just as a community care board has designated community members that are represented on their board. I would like to make sure that at least we consider Sendero, which is our health plan that we created, have community members that can speak to maybe concerns that they may have for strategies or campaigns, initiatives that can be engaged and incorporated into whatever it is that they're going to do that they can bring to Central Health that we can support. And I'd like for it to be somebody other than a staff member or a board member. I do believe, in my opinion, you can call it synergy, or you can call it, we work together, we're all the same family, blah, blah, blah. But I like to see, as a community person who is historically not realized or seen in very few examples of checks and balances, I like for there to be some different voices at the table. And different voices and different opinions, I think, help grow discussions and help members of that board or that organization look at things maybe in a different light, or take other things into consideration, different lenses. That's when you talk about diversity, and when you talk about equity, and you talk about this community, and our missions are aligned to make sure that we represent the less than 200% FPL, and providing a health plan for other people in the Travis County population that may or may not have access to healthcare under the CHAP program, which was something that we created. I want to make sure that we have our representatives on the board doing everything that they can to make sure that there are healthcare services provided to as many people as possible, and that our critically and most vulnerable population, prospective patients that we are investing in, also have maybe a voice or an opportunity to present to their boards. That's one of the things that I was speaking earlier in terms of closed meetings or at least an opportunity for the public communication to occur with those individual boards. I think that we should be as open and transparent as we possibly can be. The public doesn't have to be at every meeting, but an opportunity to be able to communicate to board members, I think, is important when we talk about equity and when we talk about communication and when we talk about opportunities for them to offer options that need to be included or could be included in strategies and strategic plans. So I'm not selling it now, but I'm trying to see whether or not we can at least have that opportunity to have that discussion and talk about it. Because I do think that it is important that there be designated seats. And I do believe that the optics is such that sometimes it's difficult to disaggregate or to separate voices. If you work or represent one agency and everybody, the majority of the board works or represents the same agency, well then why don't we just make it the same board? I don't think that was originally the intent of the creation of Sendero. I think the creation of Sendero was put together so that we could have more opportunities to provide healthcare and more services to our community members and to the people, the residents of Travis County and elsewhere, because Sendero does provide insurance to more than just Travis County. And so in order for that voice to be heard at the table, they've got to be able to be present. And so I just think that it's important for us to have that discussion as a Central Health Board as to whether or not we think that is important or not. And I think it is, and I think I would appreciate it if we could at least have the opportunity to have that discussion.
Thank you, Manager Valadez. I agree with you. I think that it is important to receive membership feedback, but receiving membership feedback does not always mean that you're a member of the board. There are numerous boards in the state of Texas where there are not the clients and the population that they serve are looked at as from an advisory committee standpoint and from surveying them, et cetera, et cetera. We here at Central Health actually go out to the community, do community conversations, and try to get input on our particular services. We don't necessarily need to appoint all of those individuals to the board. So I agree with you that input is needed. I agree with you that voices of the community help to make an organization that serves the community better off. Those are points that I cannot deny you, but I do not believe that everybody that is served by an individual organization has to be on the board. The board has to have certain skills, has to have certain experiences that allow them to move the organization forward. Part of that moving the organization forward is bringing in information from the population that you serve to make it a better organization. That's different than appointing people to a board.
I thank you for commenting on that, but what I'm referring to is self-determination and self-governance. And from a population that I historically am a part of that has never and was never included in any leadership or decision-making position for those various corporate or business or not-profit or for-profit entities, I'm one of those that thinks I'd like to incorporate a best practice. And to me, a best practice means that we look at diversity at the board level, just like we should look at diversity amongst our organization and staff, and try to achieve representation that reflects the populations that we serve. And I am one of those who believe that there are plenty of great candidates in our community that could best provide representation at a board level, regardless of whether it's for Central Health, Sendero Community Care, or any other entity, city council or county commissioners. And that if we just allow them the opportunity to submit their names for or candidacy for recommendations, that we might be pleasantly surprised
Well, thank you for
and so
clarifying that you
I
were
just-
looking for diversity, because
Yes.
that is not how you
Well,
framed your comment
no.
initially.
Diversity means not necessarily all of us being bureaucrats or all of us being lawyers, or all of us from the same group. I'm talking about diversity from everywhere that is reflective of the residents of Travis County or that area that we serve. That's all I'm saying, sir.
And I totally agree
Okay.
that diversity with experience is necessary,
And qualifications, I agree
and
with you.
qualifications.
I agree with you,
So
100%.
if you can accept the fact that they're qualified and they're diverse, I think for sure they should be considered for a board seat. Thank you very much.
I appreciate that. I think one of the things, for clarification purposes, I was also speaking in terms of, like for Sendero, just like Community Care has designated community representatives that do not reflect, they represent a specific targeted population. We have patient representatives.
Community
I'm not
care
asking-
is an FQHC.
No, I understand that. They're required
to
by
have
federal
their-
law. I know that. But with Sendero, we created Sendero. And for Sendero to take every opportunity to expand the provision of healthcare services to the community, there may be some areas that we can improve upon. And it would be great if we could adjust. All I'm saying is if we can just allow the conversation to occur, the discussion to occur, and the opportunity to occur for those entities, or those people rather, to submit or be heard, I would appreciate it. That's all I'm asking for, not a discussion on anything else. Thank you.
And I would also invite you to ask the CEO as to
I will.
what activities he does to be able to get input from his membership with regard to the guidance on his, on the health plan.
Thank you.
Thank you. Manager Motwani? Did you have anything? No. Okay. All right. Any further questions about the appointment process with regard to the governing boards of Sendero Health Plans and Community Care? Yes, ma'am.
One thing, I just saw there's one nomination, so is that under consideration in the packet?
I'm sorry?
There's a nomination for a member to be, for
These are
community-
members that are interested.
Okay.
We have not vetted them yet. We have
I
not-
understand, but this is one of the others that we will be considering.
There's a list. There's a, yeah. There will be additional names.
Oh, sorry, I
besides
did
these.
not see this, other pages. Thank you, I'm good.
All right. Any further comments on that process? If not, agenda item number 5, confirm the next regular executive committee meeting date, time, and location. Manager, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, November 16th, 2022 at 5 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment.
I move for adjournment.
I have a motion from Manager Brinson. I have a second from Manager Valadez. Any further discussion? All in favor? Aye. Any opposed? Any abstaining? We are adjourned. Okay. Our last and final meeting of tonight is our board meeting. And I would like to begin that meeting now. Good evening. Today is still October the 26th, 2022, and it is 5:50 p.m. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. First item of business will be the Local Provider Participation Fund public hearing. This evening's hearing is the official public hearing for the annual LPPF Local Provider Participation Fund rate setting required by the Texas Health and Safety Code. Notice of this evening's public hearing was published as required by statute. The hearing will begin with staff's presentation of the proposed annual mandatory payment rate. At the conclusion of the presentation, we invite comments from the public. To make comments during the public hearing, members of the public must either be physically present at the Central Health Administrative offices or have registered with Central Health via the online forum or by telephone no later than 3:30 p.m. today. We will alternate between speakers who are on site at Central Health and speakers who have joined the public hearing virtually. So agenda item number 1, receive the public comment on the proposed mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2023 under the Local Healthcare Provider Participation Program, parentheses LPPF, in Travis County, and how the revenue derived from those payments is to be spent as required by Texas Health and Safety Code, Section 298E.101. Katie Coburn will be presenting. Hi, Katie.
Hi, Dr. Bell. Good evening, managers. Nice to see you all again. I know FY22 was a busy year for the Local Provider Participation Fund. We are now starting on FY23. So if we could move on to the next slide, please. So the action request that we're coming to you tonight is to set the FY23 LPPF annual mandatory payment rate to 1.26% of net patient revenue of inpatient hospitals in Travis County. The goal is to fund intergovernmental transfer requirements for the Comprehensive Hospital Increased Reimbursement Program, or CHIRP, and uncompensated care pool payments for hospitals. Next slide, please. So just as a reminder, the mandatory payment rate for the LPPF is assessed as a uniform percentage of net patient revenue for Travis County inpatient hospitals. Based on some questions that came up in our last meeting, I have a little bit more information on that later that we'll go through. This rate is set by you all as the Board of Managers. Central Health, as the LPPF administrator, then collects the funds, holds them in a fiduciary capacity, and then uses those funds only for legislatively defined purposes, which are intergovernmental transfers to leverage federal supplemental payments. We collaborate with hospital representatives on the uses of the funds, and our goal in doing this is to maximize federal funding available to the community for healthcare for the population we serve. The final rate that we set in FY22, you all set in FY22, was 6%. That rate has now been collected, and we are moving to set a new rate for supplemental payments in FY23. We do expect, as these programs, there are changes and delays in information from HHSC, which may require us to amend this again throughout the year. But this rate that we are recommending you all set tonight will fund the next 2 major supplemental payments. So next slide, please. So just to clarify, which facilities are assessed, and then from our enabling legislation, you can see that's a hospital not owned or operated by federal, state, or local government, and provides inpatient hospital services. So for our purposes, this is all private hospitals located in Travis County that are licensed to provide inpatient services, including medical and behavioral health facilities. For 2023, that will be 22 facilities in Travis County. Next slide. And we, as we've said, the requirement for this type of assessment is that it be both uniform and broad-based. And so uniform means all hospitals are assessed the same percentage of their net patient revenue, which we get from consistent funding data sources. And broad-based means all hospitals in the same class are assessed. So for our purposes, private hospitals providing inpatient services is the class. They are all assessed throughout the jurisdiction. And below is just an example. It's a basic calculation of percentage, and that's how we determine what each facility's mandatory payment is. Next slide. So for this evening, just to wrap up, the action we are recommending to the board is to set the FY23 rate at 1.26%. For these purposes, it will bring in about $47.8 million to fund IGT requirements for these programs. And I'll close there.
Oh, thank you, Katie. I appreciate the presentation. At this point in time, we will, Yesenia of the Central Health Communications Department will briefly cover the guidelines for the public hearing portion of the meeting, and will then call upon members of the public to comment. Once Yesenia has recognized a member of the public, please approach the podium if you are physically present, or if you are attending virtually, a member of the staff will unmute your microphone and invite you to turn on your video if you wish. Please begin your comments by stating your name. If you are attending the hearing in person at Central Health, staff will direct you where to offer your comments. There's a 3-minute limit for comments per board rule. I'll turn it over to you, Yesenia.
Yes, thank you, Chair Bell. There is one member of the public who wishes to speak for this public comment. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific, well, we know the agenda item number, apologies. You will be given 3 minutes. I will be timing you and will announce when you have reached your time limit, and will allow 30 more seconds to wrap up your comments. At this time, I will call upon Jeronimo Rodriguez. Please unmute your mic.
Thank you. Good evening, Chair Bell and managers. My name is Jeronimo Rodriguez, and I serve as the Chief Advocacy Officer for Ascension, Texas. And I'm pleased to speak before you today to voice Ascension, Texas support for the proposed mandatory payment rate of 1.26%. Ascension, Texas serves as one of the largest safety net providers in Central Texas, with a network of approximately 11,965 associates, 14 hospitals, and 129 care sites, including Dell Children's Medical Center, the region's only comprehensive children's hospital and pediatric level 1 trauma center, and Dell Seton Medical Center at the University of Texas, the region's only level 1 trauma center for adults. Our mission is to create a compassionate and just society by delivering personalized care to all, with special attention to persons living in poverty and those most vulnerable. And since 2019, the Travis County LPPF has helped further our mission by allowing our community to maximize the return of federal resources to care for those who are in need. Ascension, Texas appreciates the proposed initial mandatory payment rate for FY23, as it sufficiently supports the comprehensive hospital increased rate program and the uncompensated care program. We appreciate our partnership with Central Health to secure necessary funding for our patients, and we're grateful for your leadership and are always here as a resource. And so thank you again for the opportunity to testify in support of the proposed rate.
Thank you very much, Mr. Rodriguez. We appreciate your comments, and we also appreciate our partnership with Ascension. And thank you again for providing that information.
Thank
you.
And that is the last of the public comments for this.
Okay. Thank you very much, Yesenia. I'm now ready to accept a motion to close the public hearing.
So moved.
I have a motion from Manager Valadez. I have a second from Manager Musaitis. Any further discussion? All in favor?
Aye.
Any opposed? Any abstaining? Motion carries. We will now proceed to the consent agenda. I need to read them. Consent agenda C1, approve the minutes of the Central Health Board of Managers, August 31st, September 7th, and September 26th, 2022 meetings. C2, receive and ratify Central Health investments for September 2022. C3, approve the reappointment of Ms. Betty DeLargy and Mr. Juan Garza to the Sendero Health Plans Board of Directors as recommended by the Executive Committee. Manager Valadez, did you want to make a motion?
Yes, I move that the board approve consent agenda items C1 through C3.
I have a motion. Do I have a second? Manager Brinson? I have a motion from Manager Valadez. I have a second from Manager Brinson. Any further discussion? Manager Motwani.
I just wanted to thank Chair Betty DeLargy on the Sendero board and Mr. Juan Garza for not only their service, but also their mentorship in the last year and some change that I've been serving on that board. Thank you.
I totally concur with that, Manager Motwani, and definitely add my support to that comment. Any further comments or discussion? Hearing none, all in favor? Manager Jones?
I just want to reemphasize what I had discussed in our executive committee, that as we go forward, that we emphasize the role of our appointments in those things. So I just want that on the record before I vote.
Sure. And I also think that that adds to it a responsibility, if what I'm hearing from you.
Yeah.
Okay. Any further discussion? Hearing none, all in favor? Aye. Any opposed? Any abstaining? Motion carries. At this time, I will entertain a motion to limit debate on all items in the regular agenda for our meeting this evening. Do I have a motion? I have a motion from Manager Motwani. I have a second from Manager Brinson. Any further discussion? Manager Musaidi. The motion should have been, I move that the Board of Managers limit the debate on all items on the agenda to 3 minutes per member per item. That's the motion that Manager Motwani made. And Manager Brinson, second. Any further discussion? Hearing none, all in favor? Any opposed? Any abstaining? Motion carries. Members, we will be taking the agenda out of order this evening. Item 4 will follow immediately after item 1 due to a number of people to be introduced in that item. The remaining items will be taken up in order. Agenda item number 1, discuss and take appropriate action on the proposed mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2023 under the Local Healthcare Provider Participation Program, parentheses LPPF, in Travis County, and how the revenue derived from those payments is to be spent as required by Texas Health and Safety Code, Section 298E, .151. Do I have a motion? Manager Valadez.
I move that the board approve the fiscal year 2023 LPPF mandatory payment rate as proposed by the Central Health staff.
Do I have a second? Manager Musaiti. So I have a motion from Manager Valadez, a second from Manager Musaiti. Any further discussion? Hearing none. All in favor? Any opposed? Any abstaining? Motion carries. Agenda item number 4, receive and discuss a Central Health Enterprise State of the Organization update by State of the Organization update. Mike Giesland will be presenting.
Yes, thank you, members. I've been wanting to do this for a while, and it's trying to find the right spot in the agenda, but more importantly, getting past the budget process. I wanted to introduce the leaders of the organization, and these are officers and department executives and executive advisors and situation managers and some lawyers thrown in. And so we I'm very blessed to be able to work with this team. Some faces you've seen all along. I'm going to go ahead and awkwardly reintroduce them as if you've never met them before, because I think you should also know their titles. And some faces you have not seen very much at all, or perhaps had the opportunity to meet. And so it is my privilege to start introducing people, and you can stand up or wave, whatever suits you. I would like to do this quickly, so some folks got different responsibilities they need to get out to. Please don't all run to the parking lot at once. With that, Perla Cavazos, Deputy Administrator, I'll ask her to come up and introduce our, I think, newest member to the team for government relations.
Thank you, Mike. Yes, I'm very pleased to introduce our new government relations manager who started on Monday. His name is Paul Emerson. Paul, can you stand? Yes. We've been without a government relations manager since May, so I'm very excited. But I just wanted to share a little bit about Paul's background. I feel very fortunate that we were able to hire him. Paul has a bachelor's in political science and speech communications. He also has a master's in business administration, and also he has a law degree. Paul has extensive legislative experience and has worked in both the Texas Senate and the Texas House. Most recently, he worked for Senator Royce West, and he also worked at the Texas Association of Counties for over a decade, working on policy analysis related to counties and to the budget. So that's just a little bit about him. Please help me welcome him, and you'll be seeing more of him.
Thank you, Perla. Next, John Morgan, Chief Operating Officer for the Healthcare Delivery. You may think that he just simply answers questions about specialty care, but actually is in a dyad with the Chief Medical Officer, leads the largest division within Central Health. Then we have Stephanie McDonald, who's the Vice President for Enterprise Alignment and Coordination, in parentheses, real estate, all things real estate. And as you all know, but really more importantly, coordinating with our care providers and teams as we develop these real estates. So it's a very important role, and one that seems to be redefining itself weekly at times. So thank you. Next is Mackenzie Frazier, Vice President of Compliance and Compliance Officer. In addition to compliance, Mackenzie is standing up a risk management program that you all had approved through the budget process and heard a brief presentation on a business case for. We have Ted Burton, Vice President of Communications, and in addition to running the communications team, which you've heard a lot about, and seeing the strategies, also part of the external affairs, which works with Perla, myself, and others, and now Paul, to make certain that the messaging and the tone is right, and reminding us that people pay attention. So thank you. Monica Crowley, Chief Strategy and Planning Officer and Senior Counsel. Monica has the dubious distinction of knowing what is in probably every contract and affiliation agreement, but also, and that's an important part to not to make light of it, because if you think about what our strategy is, knowing the affiliation and the partnerships is critical, but also leading the healthcare equity planning efforts as we set a new course forward in striving to not just achieve health equity in concept, but in reality, which is happening today. Then we have John Clark, Chief Information Officer. John texted me here just shortly before the meeting. He was not able to join us, but as you know, he leads the joint technology team. Next, Jeannie Verdon, who you all met informally, but I would like to formally introduce her. She is our new Chief Human Resources Officer, and comes to us from Community Care. And let's please take a moment to welcome Jeannie.
So do you always steal community care stuff?
Shh. Jeff Canola, Vice President and Chief Financial Officer. What else can I say? Jeff speaks for himself, I should say that. But Jeff, in addition to having The chief financial officer role, really just putting a lot of time and effort and energy into working with Lisa in the finance department, but also as a financial strategist. And so it's, again, when you think about, one of our key objectives in having financial sustainability, you have to have somebody that's thinking and looking around the corners constantly as things move around to make certain that we have a sustainable financial strategy. Juan Garza, Special Advisor for Development and Community Affairs. You all obviously got the opportunity to visit with Juan just a moment ago, but Juan's one of those individuals, in addition to serving on the Sendero board, is somebody that I just call up and say, hey, what are you hearing? And Juan's very connected in the community and also with his experience in various real estate endeavors as part of the real estate team that Stephanie leads. Let me distinguish between real estate team in terms of advising and strategy versus real estate folks that work in the real estate departments. Lisa Owens, Deputy Chief Financial Officer. Lisa's obviously you've heard from many times before, but just wanted to point out not only the growth in the financial department, but the changes in process improvements that we've made both in contracting and procurement and also the work with historically underutilized businesses has just been essential to how we've been growing as an organization. Dr. Alan Shalsha, Chief Medical Officer. I mentioned Alan just briefly, but again, comes from community care, and we all know about what that means. Now, I'll recognize Alan in just a moment so that he can introduce some members of the team in conjunction with John Morgan. But as you know, as we get into the direct practice of medicine and continuing with our partnerships, but being additive and bringing about much needed specialty care and standing up clinical teams and all the protocol and the processes and the procedures that go along with that, you need a chief medical officer that has been there and knows how to do that. And so we're thankful that Alan's part of the team. Rayette Smith-Hearn, executive advisor and person responsible for keeping Mike calm, to say the least. And so Rayette comes to us, her reputation precedes herself. So those of you that have been in and around state government know of her work and human resources and also other organizational transformation type work, but also her role as a board member in national organizations and also working with Defense and National Guard. Really brings a lot of insight and breadth of experience to us in terms of how we're working through operationalizing and also our operability as an executive team in an organization. Megan Cermak, there she is. Yes, thank you. Megan Cermak, although she reports to Monica Crowley, she's the Director of Public Health Strategy and Policy. Megan works directly with myself when we have a disaster response. And so you all heard from Megan quite a bit during the pandemic. I'd like to take this reminder to encourage everybody to continue to get boosted. As I know Megan will want me to say that, but it's important to understand that as we grow as an organization, you're going to see more and more matrix reporting. And I think this is a good example because there are individuals that they may have a day-to-day boss, so to speak, but they may be assigned to a team and they're responsible for managing that team. And that's the role that Megan plays for us when we have disaster response, also known as Response Team 1. Emily Ferris, Senior Project Manager for the CEO's office. Emily's the one that makes certain that we know what it is that's on the CEO's docket and is helping with setting up CEO clearinghouse so that as we work to address span of control issues with the CEO, we grow more complex, making sure that everything has a home. We know where it is, but then that it comes back on the way that it's needed. And also helping to manage projects that are typically managed out of a CEO's office, including running through a lot of various test exercises with the executive team. Now I'm going to shift to the legal side. Of course, you all know Teresa Brown and David Duncan. They need no introductions with the Travis County Attorney's Office, but unfortunately, Teresa made the mistake of giving me her mobile phone number. You did exactly what David did, and I'm glad you did. But I won't go a whole lot into detail in explaining the relationship between Travis County Attorney's Office and Central Health, but they are our statutory legal counsel for us. And then next, Randy Floyd, Chief Legal Counsel for Healthcare Delivery. Randy works in the Healthcare Delivery shop, previously with the Community Care Collaborative. But as we were making those transition and pulling those staff over, Randy and I think one other were the last two staff to come over. And so we're fortunate that Randy has brought his experience in looking at healthcare contracts and drafting and creating and designing the healthcare structures, the contract structures that we have, in addition to participating in other legal matters. So with that, please give these folks a round of applause for everything. Absolutely. So what I'd like to do, we have a set of pictures that we'll present for you. I'm going to turn it over to Alan and or John Morgan. Alan, take it away. So members, as they're coming up here, I wanted to say, there's a lot of people that we need to introduce in this organization as we are at this inflection point where we're growing. Remember, we're going to add over 130 people to this organization in the coming fiscal year. From time to time, we'll take a moment to try to do some deeper dives into the divisions, this being the largest one, but just introducing you to some of the leaders that are within the divisions that report to the individuals that you see sitting here in this room today. But we're going to start with healthcare delivery, and then we'll branch out to other departments over the course of the year. Thank you.
All right, thanks, Mike. Good evening, Board of Managers. John and I are thrilled to be able to share a little bit about the rapidly advancing and expanding healthcare delivery team. I'm going to ask for your forgiveness as I'm going to read some of the bios and some of the information related to team members. It would be virtually impossible to do justice to these individuals without having a cheat sheet. Can we go to the next slide, please? All right. Dr. Jewel Mullen serves as Director of Health Equity and Quality within our Medical Executive Board. Through her expansive achievements, Jewel has earned national and international recognition for her leadership and resolve in improving health outcomes by fostering collaboration across community, public health, and healthcare systems. Jewel earned a bachelor's degree and a master's in public health from Yale, where she also completed a postdoctoral fellowship in psychosocial epidemiology. She graduated from Mount Sinai School of Medicine, completed her residency at the Hospital of the University of Pennsylvania, and is board certified in internal medicine. She also earned a master's of public administration from Harvard University's John F. Kennedy School of Government. Dr. Mullen's robust experience includes clinical research, administrative, and teaching roles, with a focus on improving health outcomes for individuals underrepresented and underserved. She has had various leadership positions within the U.S. Department of Health and Human Services, the Connecticut Department of Public Health, the Bureau of Community Health and Prevention at Massachusetts Department of Public Health. In these roles, she's led various epidemiology, disaster response, quality improvement, and health equity initiatives. Jewel serves on the editorial board for the CDC's Morbidity and Mortality Weekly Report, the Robert Wood Johnson Foundation's Policies for Action National Advisory Committee, and the Medical Education Committee, School of Medicine at Mount Sinai. She's also a member of the board on population health and public health practice at the National Academy of Sciences, Engineering, and Medicine, and she's held faculty appointments at the Schools of Medicine for New York University, the University of Virginia, Yale University, and Tufts. Currently, Jewel serves as the Associate Dean for Health Equity at Dell, and is an associate professor within internal medicine and the Department of Population Health. So we are really grateful to have Jewel on board. Next, we go to Audrey Kwong. Dr. Kwong completed her undergraduate studies at MIT and her medical studies at the University of Chicago, at Pritzker School of Medicine. She then completed her residency training in internal medicine at Santa Clara Valley Medical Center in San Jose, California. Post-training, Audrey worked as a hospitalist within the Department of Medicine, within that same institution for close to a decade. She also served as the medical director for respite within the county within Santa Clara. During that time, Audrey held an appointment, a clinical appointment at Stanford. Audrey first joined the enterprise at Community Care, and this was in 2017, as an associate director, and has served as a subject matter expert for individuals experiencing homelessness. Since her arrival here, she's held a faculty posting as an assistant clinical professor within the Department of Population Health at Dell. Audrey's the person who establishes care for at-risk populations during hurricanes. She's always the first to go out. She's also the person who, during the snowpocalypse, traveled to the convention center to take care of individuals that were suffering from frostbite. When we think of Audrey, we think of Audrey having an MIT brain and a Disney heart. And I'm very proud to share with the Board of Managers that Audrey has just been given the Travis County Medical Society Humanitarian Award.
Oh, wow.
Next slide, please. Dr. Hamali Patel serves as our Director of Transitions of Care. Hamali received her bachelor's degree in biology from UT here in Austin. Following that, she went to UT San Antonio, where she underwent her study of medicine, and then completed her training in internal medicine in Chicago at the University of Illinois Hospital and Health Sciences System. Following that, she completed a global health fellowship in Port-au-Prince, Haiti, and has just completed her master's in public health at University of North Texas. Hamali has received multiple awards since being a clinician here in Austin. Travis County Medical Society selected her as one of their COVID healthcare heroes, and this was in 2021. She's also received hospitalist and internist awards of the year from Dell, and has received multiple teaching awards. Dr. Patel practices within the complex care clinic at Community Care, and so really has a front row seat to the complex patients that really need to transition between organizations. Sitting opposite her on the screen is Dr. John Jordan, and John serves as Director of Clinical Informatics and Care Integration. One of the things he does is oversee kind of our Epic programs, our electronic health record system, its rollout and its governance. Dr. Jordan received a Bachelor of Science in Biology from Florida State University, his doctorate in medicine and Master of Public Health from the University of North Carolina, Chapel Hill, his Master of Science in Applied Health Sciences Informatics from Johns Hopkins, and is about done with his MBA from Wharton. Dr. Jordan is board certified in preventative medicine, internal medicine, and clinical informatics. He completed his internal medicine internship at Baylor, his preventative medicine residency at University of South Carolina, and his internal medicine residency at George Washington University. Next slide, please. Dr. Jim Brown. Many of you may recognize Jim. He's been with us for quite a while. So Dr. Brown serves as our medical executive board utilization champion and expert. He has close to 3 decades of experience in healthcare, both in private practice and group practice, in management roles. Dr. Brown first joined the enterprise as part of the Community Care Collaborative, and I think this was about 2016, where he helped lead kind of the medical management team. Jim has decades of experience in health plans and in case management, and really brings a different perspective to the medical executive board. He's a UT person and an Austin person, received his undergrad from UT, his medical degree from UT Houston, did his internship and his residency here at Breckenridge, and then cheated on the system and did a health executive certificate at Duke. Sitting opposite him is Dr. Nulu. She serves as our specialty representative on the medical executive board, and she's a cardiologist by training. Shanti is an Austin native. I first met her doing some group teaching at UT where we were teaching student athletes. She received her master's in social anthropology and her master's in public health in global health from Harvard. After obtaining her medical degree from Baylor College of Medicine, Dr. Nulu went to complete her internal medicine residency at Columbia University, New York Presbyterian, as well as completing a fellowship in cardiology at New York College of Medicine, and then completed an imaging fellowship at Yale University. She serves as a clinical associate professor with Dell and is an attending physician with Ascension Texas Heart and Vascular. Next slide, please. All right, the cartoon or the painting on the right-hand side of the screen is a painting done by the artist and the activist Bansky. He is a British activist and artist. And what I really like about, and this painting was done in 2020. And what I really like about this is a little boy playing with superheroes. Yet if you look closely, the superheroes that we would stereotypically think the boy is playing with are sitting in the basket next to him. And what he's playing with and the superhero that he's holding is a nurse. We all know that during the pandemic, the nurses were our superheroes. And the next person I'm going to introduce is Debbie King. Debbie King first joined the enterprise as a member of community care. She joined as a nurse manager. She was most definitely our superhero during the pandemic and remains so. Debbie was promoted to the position of Director of Population Health and oversaw the nursing staff at community care. She has over 30 years of nursing experience, maternal child health, general health, and in emergency settings. Debbie has 2 degrees from UT Brownsville and is serving as the Director of Nursing for our clinical environment here at Central Health. And with that, I will turn it over to John.
Great. Good evening, managers. I'm John Morgan. I'm our Chief Operating Officer. So in addition to highlighting some of our recent additions from a clinical leadership standpoint, we really wanted to talk a little bit about how every step of the way and with each of our service delivery initiatives, particularly in our direct practice of medicine, we have staff partnering at every level from a clinical and operations standpoint so that our work is successful, it's well informed, and we've got diverse perspectives involved in our work. Alan and I and many others in this room reflect pretty frequently of how lucky we are individually and as an organization with the caliber of individuals that we are able to recruit and retain to do this work. And not to mention just great human beings to work with and be around. I will note that everyone that we've mentioned, like all of our staff and those that I'll highlight, these are folks that choose to be here. They have other opportunities and they choose to do this work. They choose public service, they choose service to others, and they really live the mission of Central Health every day in their work. I'll start with introducing Cynthia Gallegos. Cynthia's been here with us for just under 7 years now. She leads our service delivery operations department, and that's really the department that I'm going to focus my comments on. If we highlight every leader in healthcare delivery, we will be here all night. Really wanted to focus in on our leadership in healthcare delivery that is leading our direct practice development. So think about Rosewood Zaragoza, the transitions of care and medical respite work that Alan mentioned, and I'll also highlight some of our operations team that's leading our EHR implementation for Epic. So Cynthia has been with us for 7 years, as I mentioned, leading our service delivery operations department. That includes all of our service contracts with our network providers, all of our service expansion initiatives in healthcare delivery, as well as our project management office. Cynthia started with us as a project manager early on in the DSRIP program. She then moved into a position managing a portfolio of service lines and related initiatives as a service delivery operations manager, and most recently served as the director of our service delivery department. As of this week, Cynthia is now our VP of operations, and we will be adding to her scope, really already adding to her scope, to lead many of the components of our direct clinical practice. Margarito Flores is a service delivery manager in Cynthia's department, responsible for a portfolio of specialty care services and initiatives and contracts and relationship management that go along with all of those. Each of his initiatives could certainly be a full-time job. His work has included operational leadership over our surgical podiatry program, launching our transitional dialysis program, and for the context of tonight's presentation, he's also leading the development of the Rosewood Zaragoza multi-specialty clinic. So prior to Margarito's employment with us, he has significant practice management experience and FQHC experience. He also came from community care, as did I, manager excited. So the trend continues. Margarito served as both a project manager and the practice administrator of Runberg, of South Austin and Southeast Health and Wellness at different points. So thrilled to have him on the team and helping lead the development of this effort. Next slide, please. Two others that are involved heavily in leading our Rosewood Zaragoza development. I'm excited to introduce Daniel Cerna. He's probably a little less familiar face. He's a more recent addition to our team and joined us as the practice administrator for Rosewood Zaragoza. So Daniel joins us with more than 20 years of healthcare experience, including practice management in safety net healthcare settings, call center leadership experience, claims and coding. And in his role, he's going to help lead the recruitment, hiring, onboarding, and training of our operations and administrative staff that will work in the Rosewood Zaragoza clinic, and then he will oversee day-to-day operations of that clinic once services launch. Brittany Hines is one of our amazing senior project managers. So she supports a variety of projects and initiatives, but again, for tonight, she helps lead the project management role of Rosewood Zaragoza and working with bringing all the pieces together and the timelines that need to come together in order to make that happen. Of note, she also served as the project manager to help us launch medical respite services in the past year, and she also joins us having worked at community care for, I think, over 6 years. Next slide, please. This is my last slide. So on this slide, just to highlight two more leaders. Again, these are the two folks on our team and Cynthia's team that help us with the Epic EHR development and implementation. Josh Rivera is another of our service delivery operations managers on Cynthia's team with a portfolio that includes our EHR, our patient access and call center services, our pharmacy service line, as well as our clinical operations and Epic training teams. Josh also served as a practice administrator at Community Care for around 5 years, including leadership around intensive outpatient services, healthcare for the homeless, and leading street medicine and mobile clinic services. And last but not least, Kirsten Muldrum is our senior project manager, leading the Epic development and implementation alongside Josh, among many other projects, including our heart failure transitions of care and expanding access to tubal ligation procedures in partnership with People's Community Clinic just this past year. Kirsten previously worked for Epic as a project manager and implementation consultant, supporting implementations for major hospital systems across the country. In addition, Kirsten is a dietitian and a certified diabetes educator. She has experience in weight management programs, and also at-home tube feeding programs. So again, these are just a few of our recent leaders and leaders who have moved into roles to help us launch direct practice of medicine. There's a lot of movement and certainly many others that we can and will highlight to you all when we can find an appropriate opportunity, but really wanted to showcase some of the folks that are leading this effort for Central Health.
Too long, so that you all can put some names with some faces, but also actually probably get some job titles and go, yes, now I know what that person does. So they don't just show up to board meetings. There's a whole lot that they do. Moving on to the next piece of the state of the organization, and I realize I've got probably less than 10 minutes on allotment, but Dr. Bell, if you'll permit me, I would like to go ahead and present this evening. I'll talk about the workforce demographics and then talk about how we determine who we are and what we do and how we get there. So on the workforce demographics, much thanks to the HR team, especially Betsy Good, to help us pull this information together and also create some interactive dashboards. And Jeannie, you were very instrumental in that effort as well when you were serving as acting director. But this is information that we can push out there, and it's important because while you've met some people tonight for the first time, or maybe you've learned something about somebody that you've been working around as a board member, it's important that we have this information out there for transparency as to who we are as an organization and what we are aspiring to be. There are some other slides that we'll touch on this one just briefly in the upper right-hand corner under employee tenure. You could look at that and go, oh, okay. And maybe put some of those columns together and get a sense about, okay, for 3 to 7 years, you've got roughly 30% of your workforce at a 3 to 7 year tenure. But we don't just look at these to be able to say this is just the current state of things. You actually use these as management tools. And so, for example, what jumps out at me is that at the 2 to 3 year mark, you have 10% of your workforce. And so when you think about having pathways and having folks that you can promote and perhaps provide other opportunities as the organization changes, you really want to zero in on that 2 to 3 years and understand what is occurring there. And that's where we start, have quarterly sit downs where we go through exit interviews and really understanding why individuals are leaving the organization. But I think as we continue to grow, we'll have more opportunities. Just earlier today, Jeannie and I were talking about, creating much more intentional pathways and making those very clear to individuals that are part of the organization. So that will continue. The second thing that I think is important about employee tenure, and this is an executive leadership team exercise from earlier this year, was really focusing in on onboarding. And it's not just the first 90 days. It's the 15 days before you get here, the 90 days after you, or while you're first here, and then at that 18-month mark, before we see any turnover at 2 years. So it's the entire onboarding process that is going to receive intense focus so that we can make sure that we have the employee tenure necessary as we grow. Next slide, please. So this shows the race and ethnic demographics relative to the population that we serve. We typically show this relative to Travis County, but through past conversations with the board, you were really interested, and rightly so, how does this line up with the population that we serve, which is noted on the right. And as you can see, through most of those bars, you've got representation, but we still have a lot of work to do, meaning representation that lines up with the population that we serve. And in some cases, it exceeds by percentages. But again, there's additional work that we have here, but I wanted you all to see this because it's an interesting comparison when you think about what the workforce is representative relative to the population that we serve. Next slide, please. This is based on a formal report that all organizations need to file, I believe, annually. It's the EEO4 report. And this breaks it down into four basic categories, into clerical, officials, professionals, and technicians. But again, it's It's the data that you've seen on the prior slides, but just broken down by EEO4 group. And I'm going to quickly move through these slides, I think in the interest of time, but then I would like to come back and have some more conversations around what we're doing. But I would ask that you allow Jeannie to continue to coming on board and us to be doing deeper dives into data and working with the HR team. So race and ethnicity, and this looks at changes over the past 4 years. And the largest changes occurred in the Black or African American group and the Hispanic or Latino group. And so it was 127% African American, then 46% in the Latino, and then followed by two or more races at 50%. So as you can see, our efforts to continue to diversify, you're starting to see some improving results. But again, this is if you think about it as culture, not work. It's not a project. It's not a task. It's culture. It's who we are. It's who we aspire to be. And so this is something that's going to continue to receive much needed attention and earnest effort as we continue to grow and expand in scope. Next, we'll go to gender. Again, looking at gender over a 4-year period. On the next slide, you have we tend to be, we have a higher percentage of females in the workforce than males. The growth in 40% for females and 56% for males. And if you'll go to the next slide, one of the things that we've been working on is expanding our gender identity reporting beyond a binary reporting. This started in April of last year, and it's a self-reporting. We have 20 individuals that self-reported, but none of them chose the non-binary gender identification. That's something that we need to work on as we make sure that we have an environment that encourages people to authentically report and express. So that's something that we will continue to work on. But we did want to note that we do attempt to capture gender information in non-binary formats. Next slide, please. So again, we're not just numbers, we're people. We have names, we have roles, we're out in the community, we have jobs. And this is one of many pictures, one set of many pictures that we could have chosen. And but again, it's really great when you see people out in the community or in work sessions and really just making reality happen when it comes to health equity. So that's what we're all about. Next, I'll talk a little bit about how we navigate. And what I like to think about when I come to work every day and close out a week or a month or a quarter or a year is, what are our guide stars? What is it that you navigate towards? And then what are the landmarks along the way that help you get there? And also report what you've seen and where you've been. And so, next slide, please. Our guide stars are things that you all set as a board. It's our mission, our values, and our culture. It's who we are. It's our budget resolution and our budget. It's our health equity plans, that Monica and her team have brought forward, and we've got the next set for our operational and financial stability plans. And it's our compliance and risk management. It's making sure that, because he's still here or not, it's making sure that our policies and procedures are what they need to be, but also that we have good risk management in place. And said another way, it's who we are and what motivates us. That's our mission, values, and culture. It's where we're going. That's our budget resolution and budget. It's what we need to resource. That's our health equity plans. And what are the guardrails? That's where the compliance and risk management comes in, so that you can stay focused and deliver for the population that we serve. Next are the landmarks. So these are things with which you're all familiar. We have the historically underutilized business program that helps not only, I've talked a little bit about our diversity within an organization, but also external to the organization in terms of the individuals that we partner with. And we have the 2-year demographic report, of which is coming up in still November, early December-ish, that shows those that we serve, where they are, and what the disaggregation breakdowns are in demographic data, but also the disease burdens that are borne by those folks that we serve. We have the annual financial audit, which has started, and then that concludes February, I believe. Looking to the back wall over there, Lisa, conclusion of the annual financial audit. January, thank you. January. Then we have reporting on the budget resolution objectives, and these are objectives that you all have set in the budget resolution. That's a foundational document for us, and we'll start bringing those reports back January through July unless there's a specific timeline. So, for example, the report on the Dell Medical School reporting matrix, I believe, has a December timeline, as does the African American Men of Color Clinic that has a specified outreach plan. So there's some things that we'll bring back to you out of cycle, but the cycle will be January through July. We have the health equity, should say plan, not PAN, but we'll bring a PAN too. Health equity plan, operational and financial sustainability plan. There's one plan. That's estimated later this spring. And then we have the MAP basic enrollments and utilization reports, and our 5-year audit review along with the county workshops. And so what these things are on these landmarks is it what informs you, the board, as you're making decisions as leaders. It's what informs us as executive leaders that are fulfilling our statutory obligations and our strategic objectives, but it's also about accountability and transparency. These are all public documents that are outward facing as much as they are internal, have internal utility, but it's how we tell the public, this is what we're doing with your tax dollars. These are the individuals that we're privileged to serve and how we are moving the needle on their health conditions and eliminating health disparities and filling gaps in the healthcare system. So those are some of the landmarks. That concludes my presentation on the state of the organization. And suffice to say that, we do have some challenges. One is we're obviously growing in complexity and size and in scope. We have evolving work expectations. For some, it's all about a career pathway, but for others, work, it's person dependent. It might be episodic or it might be experiential. And so there's changes in the way people view and approach work that we too have to adjust with that to make sure that we're as effective as we can. And then, of course, dissemination of information. That is a problem in any size organization. But we've started realigning the executive team along functional lines, but also being much more deliberate in terms of how we disseminate information. So those are some of our challenges that we have and changes in the work landscape. But my job is to come to work every day and flip on the light switch. But it's the people in this room and some of the people that aren't in this room, some of whom you got to see tonight, that make it happen. So that is the state of the organization. Thank you.
Thank you very much. You guys have a remarkable team, and the work that they do is just totally outstanding. I really appreciate this period of time to get to know them, sort of know what their official titles are. We tend to just know them by name, and we know they work somewhere. So, but exactly where, if they can answer our questions, we never ask. But appreciate this, and I think it gives us a better idea of the organization, the people that work in different parts of the organization, and what they do. So thank you for that. I really appreciate it. Okay, agenda item number 2 is to receive an update on Central Health investment policy and strategy for fiscal year 2023 and adopt the fiscal year 2023 Central Health investment policy as presented by the Travis County Cash Investment Management Department. Lisa Owens and Debbie Laudermilk from Travis County Chief Investment Officer will be presenting.
Thank you. Good evening, Lisa Owens, Deputy Chief Financial Officer. I'd just like to take a moment to introduce Debbie Laudermilk. She has not been here in front of you in a while, but you get her reports every month and quarterly reports. Debbie is the Chief Investment Officer for Travis County, and as you know, we partner with them to manage our investments through an interlocal agreement. Debbie has been the Chief Investment Officer for 10 years. Prior to that, she was at TRS for over 18 years. She has a wealth of experience, and I would just like to take this opportunity to thank Debbie and her team. They are great to work with as we've launched new things, explored new opportunities for our investments, and I really appreciate you and your whole team. So thank you. And Debbie's going to give you a presentation on our investment policy, which you adopt annually. So I will just turn it over to you.
Okay, thank you. The investment policy is guided by the state government code, and that's what the PFIA is. The first slide is the prudent person rule is a basis of all investing, whether it's state, government, whatever, because you want to preserve capital. And now's kind of an interesting time to be bringing this up, as Jeff would talk to you about. Yes, it's been a fun time. The policy, the only change that we are requesting this year is a change in the commercial paper maturity date, or maximum maturity, which was 270 days, and now it's been changed to 365 days. And that is really more to match up with the code. It's not something we anticipate doing because there's very limited companies that issue commercial paper that far out. Just to go through some of the pages, the next slide, you have that up. Okay. The Public Funds Investment Act just goes over what your purposes are for investing. The most important part of the act are the three principles that are up there: preservation and safety of principal, which that is first and foremost, because you want to make sure that the money comes back and that you're liquid and can pay for operating expenses and everything. Next is liquidity, and last is yield, which isn't typically what a lot of people do for investing. They're more focused on yield than anything else, but because it's our job to keep your money safe, that's the first and foremost principle. A written investment policy has to be adopted every year, and it emphasizes these qualities, and it goes through a lot of different things about the different types of investments, how long you can, what maturity you can go out to. With the healthcare district, it's 4 years. At Travis County, the operating fund is 5 years, and the pool bond fund is 3 years. So, and I figured you could read through most of this because it's kind of boring. What? Yes, it is important. Then it goes through authorized investments. The investments, typically what we stick to are government agencies, treasuries. We haven't used certificates of deposit because you're really only supposed to buy them in $250,000 tranches, which that would take forever because typically our investments at a time are, a couple $1 million. So we haven't used repurchase agreements. Securities lending program we did use for a while when rates were at a different place. And so then on the next slide, and this is where we change the maturity of commercial paper. All the investments that we are allowed to make have to be investments that are very secure, going back to one of the first premises. Government agencies are guaranteed by the government. Treasuries are guaranteed by the federal government. Commercial paper has to be highly rated. A1, P1 is a rating that's very high for those companies. And the same with some of the other investments. We do invest there's a number of municipal bonds that are in the portfolio. Those are all highly rated communities that are issuing debt, and the same with the commercial paper. There are numerous overnight pools that were created in the state of Texas. And overnight pools mean that in some ways, it's kind of like a bank account in that you put money in each day and take it out when you need it and everything else. So their rates right now, the rates of the pools are up to 3%, which is pretty good considering they've been close to zero for quite a while. So, and the three that we invest in for the healthcare district are Texas Term, which is now also goes by Texas Range. They changed the name, TechStar and TexPool. And they, it helps with liquidity in that we don't need to put them in the bank. And what we do is we keep, every day when we do cash, we make sure that in the operating fund, there's $100,000, just in the event that something comes in overnight to cover those expenses that weren't anticipated. So the diversification of investments, it shows the different investments, and treasuries are the most you can put 100% in those. The other ones, are a lot less. LGIPs, the pools, is 80%. And TexPool, which is a Texas state pool, can go up to 50% of assets. Training, we all have to take training. It's 10 hours. And a lot of the conferences that we go to provide that training by listening to the different speakers on the different topics. The next page is one that's, for me, it's kind of scary. You can see what the unemployment rate, that's a great trend, but unfortunately the inflation rate is not good. And the Fed has done what they can. And my guess is the next meeting in November, they will raise another 75 basis points, and possibly in December. I think there's a good chance that rates will get up to 4.5% sometime next year. Which, one of the things that I've noticed over time, because I started in the investment world right out of college, and that was a teacher retirement system. And the one thing that I noticed back then, it seemed that investments were more focused on what happens in the United States. But now the global economy is so important to everything that's going on. And that's kind of what I was trying to show here. And unfortunately, there's lots of instability across the world. And inflation is a huge issue for almost every country. And again, then on the next slide, that just is more about the things that we're looking at all the time. The housing market, especially here in Austin, has been unbelievable, but now is slowing down. And the problem too with that, with what's going on in the economy right now, is that your mortgage rates are up to 7%. And that is a huge difference for people and the ability to afford a house. I mean, not only have our values gone up, I mean, we downsized a couple years ago, and 3 years ago, and our house has already doubled in price. And it's like, I can't imagine going out and getting a mortgage now at that price. So, there was I was at a board meeting for actually Texas Range. I serve on their board this morning, and we had a lot of economic discussions. And one of them was that they, was about rates and inflation, and that inflation most likely isn't going to fall quite as quickly as we'd like it to. And it's going to keep going up, which is going to cause the Federal Reserve to raise rates. We also discussed whether or not, why not just raise rates 2% at the next meeting? Well, that kind of throws things off, and it's better to do the increments instead of doing big chunks like that. This page shows the diversity of the portfolio as of September 30th. As you can see, there's 52% in government agencies and 16% in municipal bonds, and the rest essentially are in the pools. The performance is what happens when you go out further. When interest rates are going up, you start to lag your benchmark because your benchmark typically can change almost daily. Versus when rates are going down, we have a better position and we're outperforming the benchmark because we invest longer term. And so as you can see in this chart now, the rates are getting up there to where our performance is pretty much the same as the benchmark and maybe a little bit underneath. So. In the next page, it's not a page I really wanted to talk about, but somebody asked me to. It's about, yes, and fair value investing and reporting. At the end of September, there was the market value of the portfolio, of Central Health's portfolio, had lost $19 million over the year. This is not a cash item. This is an item that you have to report according to all the rules and accounting regulations. And as you can see, and the reason I gave several years is so you could see the differences based on what the rates were and the values of the portfolio. Obviously, the portfolio has grown dramatically over these 5 years that I've shown. And the market value of the pools always is stable. So that's why I put the amount in the pools at the very end, because their market value and cost is the same. And as you can see, for 2022, the interest and dividends we managed to make was $3.6 million. And the market value did decline, but it's not something that is real. It's not like you had a $19 million loss. And my thought in the strategy of this is that instead of realizing this loss by selling these securities, it's better to hold on to them and get the face value that we bought them at. And one of the things about the market is if the prices of the bonds are going down, that means the yield is going up. And usually the bond market is the opposite of the stock market. The stock market's going up, the bond market's going down. So it all plays in together. There have been some unusual times, in fact, not that long ago, a couple weeks ago, where it was a Friday and I think CPI had been reported and it just kind of blew everybody away. And, the market plunged like 1,500 points. And then by the end of the day, it was up like 50 points and it was just crazy. So, and that's one of the things that in my position, you have to be aware of all the time is, what's the market doing? What are the rates doing? And yes, we invest for the long term for you guys, but at the same time, you just have to be aware of all that and be able to react to it. The time of year that I typically start investing is when the tax revenues come in. So usually they come in the end of November, December, and then definitely in January is a big chunk. So, by then rates will be up more and we'll be able to buy bonds at higher rates and ladder them out so that, we can meet all the liquidity needs. So, and does anybody have any questions?
Any questions, members? Comments? It's not. Amit.
Sorry it took me long to decide if I wanted to ask this or not, and this may not be the place. First of all, thank you so much. I think that's just always, I don't know, for me, it's a helpful, instructive. And then secondly, wondering, and Chair, you can let me know if now is the appropriate time or if it can be deferred. It's clearly not emergent, but would love insight, be it distilled or even extensive, around what it means for the enterprise that we were able to issue bonds and negotiate for the property at Hancock at the time we did versus where we might be now. Just around some of the moves that we were able to make. And I think what I might surmise are far more favorable conditions versus where we would be now and perhaps for the next few years in our ability or inability to make moves. And then secondly, what also that means for reserves in particular, given what may be not as good of a tax revenue season potentially, given, again, the potential for declining home values in the future. So whether that happens now or not, I'll defer to you, but I would love to kind of get an angle on that.
So are you asking me, or are you asking Ms. Laudermilk?
I'm asking Ms. I'm asking Ms. Laudermilk, and forgive me, I don't know your first name. Debbie. I'm asking Debbie, or possibly the one and only, the JK, the Pied Piper of fiscal prudence.
Well, I think as far as tax revenue is concerned, I don't think that's necessarily going to be an issue this year.
Mm-hmm.
I have heard that because of some of the proposals that are on the ballot, that it may take a little bit longer to get some of the tax bills out. I think that we're okay as far as this year's concerned. Next year, that's a whole nother story.
Mm-hmm.
So I can't remember what the rest of it.
The other one was around.
I'll take a stab at that part. So you were asking about debt issuance.
Mm-hmm.
So from a timing standpoint, there was a long period of time of extremely low interest rates, and fortunately, we were able to participate in those. Our rates. So we had two issues. We had a tax exempt, which are typically a little bit lower, and then what's called a taxable issue. Both of those were around 2%. I think the tax exempt was a little bit less. Since then, two things have happened. One, interest rates have gone up substantially. The tax exempt rates are probably double, at least, what we were able to issue our bonds at. And then secondly, the spread. So typically there's a spread between tax exempt and exempt bonds. When we issued our bonds, there was a very minimal spread, very minimal difference in the interest rates. That spread is much more substantial now. I think the latest issue, I think there was an issue today comparable, if we were to issue today, I think it was over 5%. So the tax exempt rates the taxable rates have more than doubled in that regard. So, to your question, I think it's always about the luck and how you time things and some controllable and uncontrollable events. But overall, as far as looking back, I think it was a good use of our funding to issue bonds, and we're still constantly evaluating what other opportunities we might have even going forward based on our capital requirements moving forward as we expand our direct health care, and we look at big spends in that regard, an adequate amount of reserves to look at a long-term picture for Central Health and be able to manage our resources appropriately and in a sustainable way.
It was excellent timing. I mean, essentially, rates have been near zero since 2021, and now they're up to 3%, 3.25%.
So saying that like maybe in a 15-year window of historically low interest rates, when that window was closing, we nailed it?
Yes.
Thanks. Yeah, we were very fortunate. And again, these are policies that you set as a board. I mean, it's all about, you know, what our long-term financial picture is, how we're rated by the bonding agencies, and how people look at us that want to buy our bonds, and what their sense is of the ability for Central Health to repay those bonds.
Well, then I just wanted to, I don't know, kudos to Chair Greenberg, Chair Bell, and Mike, and obviously the executive team that surrounds him on getting us there.
Thank you, Manager Motwani. Any other questions for Ms. Laudermilk or Jeff? Thank you
for being
both.
here. Thank
We
you.
really appreciate it.
I
Great
thought it was
information.
appropriate that I presented, because Mike has asked me over the years to, you really need to come and present about investments. So, yes.
There you go. Thank you very much. I appreciate it. Members, we need to approve the fiscal year 2023 investment policy. So do I need a motion? Manager Musaiti?
I move that the board accept the fiscal year 2023 investment policy as presented by staff.
I have a motion by Manager Musaiti. If I have a second by Manager Valadez. Any further discussion or questions? Hearing none, all in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Again, thank you guys. We appreciate it. Agenda item number 3, receive and discuss a report on fiscal year-to-date healthcare services for the preliminary August and September 2022 financial statements for Central Health and Community Care Collaborative. Lisa Owens and Patty Bethke will be presenting.
Good evening.
Good evening.
I'm going to take this presentation and answer any questions for you guys tonight. Due to the timing on our September board meeting, the financials for August were presented to you, but I'm going to focus on our preliminary September,
Okay.
given where we are today in October. So we have ended the fiscal year. It was a great year. As you know, when you approved the budget, we started our new fiscal year October 1st. So these are preliminary. We will be working with our auditors to produce audited financial statements for September 30th. That audit work will start fairly soon here, and we'll present those the audit results and the final financial reports as of year end in January. However, our numbers today are here on the current assets. If we can go to the next slide. I will focus on our cash position, which, as we were talking about, is the investments that our investments team focuses on and the investment policy that you just approved. We did have short-term investments of $381 million and some of our longer-term investments for capital of $89 million. Our total assets, including our capital assets, at the end of September were $702 million, and that is an increase over fiscal year 2021 of approximately $70 million. On the next slide, we'll talk about our liabilities. Our liabilities remain fairly low for our current liabilities at just under $19 million, mostly in the form of debt service payable, the bonds that we've issued, as well as accounts payable, so payments to our network of providers that are providing healthcare, as well as our vendors for operations. We had restricted non-current liabilities, which includes the LPPF funds, which are held in cash as well as a liability, and the debt service long-term at about $75 million as of the end of the year. Our total liabilities were $117 million. So the remaining net assets of as of September 30th were approximately $585 million. On the next slide, I'll talk through our sources and uses. There are some year-end adjustments that we make as of the end of the fiscal year. In property tax revenue, you'll see an accrual for the year-end adjustment. As you know, the taxes are due, but they may not be collected yet. So there may be disputes or timing issues on that. So a little bit of an increase from what you may have seen in the summer months as tax collections did slow down. But our year-end number is what we would focus on here of $261 million in property tax revenue, which is 100% of our budget, just a little bit greater than the budget. We also had other revenue. So this includes the $19 million mark-to-market adjustment that we were talking about. We categorize that as a adjustment to the negative on this and then on the balance sheet. That is also offset by almost $500,000 in interest revenue for the month. So that line item includes other items like that. So that is a one-time adjustment at the end of the year, as Debbie talked about. Our healthcare delivery for the month was about $13.5 million, and for the year was $147 million, which was about $23 million increased over FY21. In our administrative program, we do anticipate being under budget in that area. We talked a little bit about this in the budget process when we were doing our year-end estimate. We anticipate about 70% of that $13 million spent in our administrative program. So total uses, $158 million. The excess sources over uses, which includes that contingency reserve that we speak of, and we'll provide more information about that when we present the audit, of about $340 million. Going on to the next slide, I'm going to focus on the healthcare delivery at this high level and then the specialty care, just a few highlights. But we did have year-to-date close to 100% of what we planned for IGT. And then in our healthcare services, about 72% of those healthcare services, $73 million year-to-date were spent on our healthcare services. And that's what we're now calling in FY23 purchased services. Again, we had very little direct healthcare services costs with the start of podiatry in FY22. So you're going to see a new format probably on this slide next year so we can call out those direct services as we start to lift those up. In our ACA premium assistance and enrollment, anticipating just at 100% of the budget at $14 million this year for that program. And then our healthcare facilities and redevelopment at about $3.7 million year to date. We also have the operating costs for the healthcare delivery operations. You heard about many of those great people who are working every day on quality metrics, reporting, service delivery, Epic, all those things. Those teams are at about 60% of their budget at $21 million year to date. So our total healthcare delivery, again, $147 million as of the end of September. There is additional detail about the healthcare delivery line items on the next couple slides, but if we can go to the slide that has specialty care. One more. Thank you, Brianna. Back one more. I'd just like to hit some highlights. This year, we spent approximately $8.4 million on specialty care. That is about a $2.4 million increase year over year, if I did my math right at this late hour. And I wanted to just hit some highlights. You know, John Morgan and his team have been up here and talked about many of the increases we've been able to make. You saw our great new leadership in cardiology. We've seen significant increases in our ability to support the cardiology specialty, nephrology, and of course podiatry with the surgical procedures and direct services we've been able to provide. But also two new areas where you'll see neurology getting started just at the end of the fiscal year, and then dialysis, which we're very excited about that new program. So as we move into FY23, you can anticipate increased growth in those areas and those other specialties that we've shared with you throughout the budget process for FY23. And with that, I'm happy to answer any questions about Central Health.
Manager Paladin.
My throat is starting to hurt now. So just under healthcare services on page 7.
Microphone. There it is.
On healthcare delivery services, page 7. So the budgeted amount was $101 million, and year to date is $73 million.
Yes.
So what's the difference for that? For the I'm sorry, how does What is the reason for that?
So in some cases, that would be just timing on launching new services, expansion, hiring.
$30 million?
Well, I can get you a specific breakdown, but you can also see line by line.
Yes.
You can see that primary care is very close to budget. There's a $6 million difference there. But if you want, what we could do is report out to you directly some more details on each of those line items.
I appreciate that.
Okay, great.
And on the previous page, page 6, for the contingency reserve fund, the budgeted amount was 226 million, and we ended up, what is that? 235 million, 0.8. So a difference of what? 9.4?
That's, yes.
And so that 9.4 million is going to go into the contingency fund to carry forward?
Those will carry forward into the next year.
Okay, so I have a question, and I don't know whether it's appropriate to bring it up. I know that when we were going through the budget process, there was a lot of interest in expanding services, especially in the chat program. And what I was curious, or what I wanted to know, was whether or not we could go ahead and look at that 9.4 million for chat expansion and bring on more patients that we could provide services for and pay their premiums for. I know it was very successful. I wanted to know whether that was something that we could do, and what I'd like to do, if that was possible, can I make a motion to see whether or not we can do that?
There's really no need to make a motion. There are people that are, I know.
Working on it?
Wes has been tasked, and Mike has individuals here in Central Health that are tasked to look at those items that we promised the Commissioners Court that we were going to look at. And that is definitely one of them. I think once they get started and can come back to us outlining, first of all, monies that are needed, and then secondly, a model. So that, I mean, first of all, the chat program, sure, we can sort of expand it, but as we tried to explain over and over again, we have to put the appropriate people on the chat program.
Right.
If you just put everybody on there, you're going to actually cause the health plan to become unsustainable.
Okay, sir, I didn't say that. That's not what I'm referring to. I know what I'm asking is whether or not I can, you know what, I'm just going to make a motion that $9.4 million be added if I can.
This item's not posted for action.
For action? Okay, well then maybe if we could add it to an agenda item for our first quarterly meeting with the Travis County Commissioners in Sendero to talk about this so that we can show the commissioners that Travis County Healthcare District, the Central Health, is interested in expanding services and doing our.
That's just what I said.
No, I understand that, sir, but I'm just asking whether or not it's possible to reinforce the fact that they were commissioners that were very interested in us expanding CHAP. And if we can make sure that this is a considered item for discussion in that first quarterly meeting, to see how we can address this and whether or not it can, part of this money, at least part of the 9.4 million, can be considered as a resource.
Thank you very much, Manager Bellman. Any other
Is
questions?
that yes?
I didn't know it was a question.
It was a question.
What is the question?
The question is whether we can put that on. I guess I'm looking at Mike as our CEO, then Dr. Bell. If we can please put that on the agenda with for our first quarterly Travis County Commissioner meeting with Central Health and Sendero to see how we can accommodate the expansion of the chat program and whether or not some of that or all of that $9.4 million can be used as a resource.
As I understand your question about putting that on the first quarterly meeting, I don't set those agendas.
It hasn't been set because we haven't had one
Central
yet.
Health doesn't set those agendas. But second, they, as Dr. Bell pointed out, we've got some internal conversations. I know, Jeff, you and Wes have started this process, but we are by no means anywhere near done, but just trying to figure out what are the financial parameters to be able to answer the question that you've raised. But more importantly, from looking at this from a how do we improve healthcare outcomes, the risk, and so there's a bunch of different lenses that you look through. You're gonna have to put together a really good business case before we can have that conversation and get out there and say this is what we think we could do in terms of additional subsidy or premium assistance programs. So I would say all that's on the drawing board. I think what Dr. Bell said actually articulated it very accurately. But as far as it being on a future agenda, I don't know that we really at a point yet where we could say this is when we'll be ready to roll out some not just concepts, but really well thought through business cases on this.
I thank you for that, Mike, but I just want you to know that I'm one of those that believes that a good idea should be considered and that we go ahead and try and see whether or not that can develop into an initiative that we can put forth. But the good idea putting forth is all I'm asking, that it be considered. And if there is a way to put that forward for discussion between the commissioners.
And that's what we're working on internally now.
I
Yes.
appreciate that because I think that it's important that we try and expand services to as many people as we possibly can.
Thank
And
you
this
very
would be a
much,
good
Manager
opportunity
Valdez.
to do so. Thank you.
Manager Montgomery?
Yeah, I would, along those lines, love to make sure that the feasibility analysis has had its time to work itself through. My preference would be to not necessarily reverse engineer it off of the carryover numbers, though I do think it's important to keep those carryover numbers in mind. That 9.4, I think it is going to be important to keep that in mind, and we don't lose sight of that as a board. And I also, as a manager, would like to see, first of all, the results of that feasibility analysis, what, Dr. Bell, you were suggesting, what sort of those financial parameters look like. And then, as a board, if we may get together, at least I can speak for myself, and look at what other competing priorities for potentially those carryover dollars might look like with relation to what the cost parameters are to each of the items that we may be evaluating. And so, A, I think let's keep that idea in our pocket, and B, I don't want to necessarily rush the feasibility analysis because I do think it'll probably take some time for the organizations to hash that out. So, but agreed.
Thank you, Manager Montgomery.
Thanks.
Manager Valdez,
Yes,
quickly.
Yes, sir.
please.
I'm not going to keep the idea in my pocket. I'm going to put it on the table. And it's great that that's your idea and that's your opinion for let's look at a feasibility study and everything else. But I just think it's something that we ought to at least consider and talk about. And I sure would like to do it with Sendero, and I'd like to do it with Central Health, and I'd like to do it with the county commissioners. And if there appears to be some need for assistance, I want to be part of that team that's evaluating that and talking about how we can bring people to the table that can make it happen. Thank you
very much. Any other comments or questions? Hearing none. Thank you. Is that, you have a community care collaborative, right?
As of September 30th in the CCC, primarily cash and assets of $17 million. We also had liabilities for services rendered of approximately $4 million and deferred revenue, which you'll recall is revenue that we've received for items that will be under review for the DSRIP program of $9 million. Total liabilities of $13 million and net assets of just under $4 million. On the next slide, the sources and uses of funds. We had $44 million in DSRIP revenue in FY22. We also had other sources, interest income, for total sources of funds of just under $54 million. The uses of funds, $15 million in healthcare delivery, the UT services agreement of $35 million, and DSRIP project costs for the year, the last year of that program, $5.2 million. So again, a total of $55 million and net assets of $3.6 million. And on the next slide, the last slide, just goes through a little bit more detail on our healthcare expenses year to date in the different areas of specialty care, behavioral health, and post-acute care. Again, total expenditures year to date, $15 million in the CCC for those services.
Any questions, managers? Comments? Okay, thank you very much, Lisa. Appreciate that report. And
Thank you.
we will move on to agenda item number 5 and 6. I'm going to lay out both of the agenda items. There will be presentation on both for open, short, very short, and then we will go in closed session and also be provided some information with regard to those two agenda items. So agenda item number 5, receive and discuss an update regarding Sendero Health Plans Incorporated, including A, an update on the Central Health Premium Assistance Program, CHAP, and other subsidy programs, and B, financial update. And agenda item number 6, discuss Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health Downtown Campus administrative offices of Central Health Enterprise Partners and new developments in Eastern Travis County, deliberation and action on possible delegation to the president and CEO to purchase property. So, Wes, you want to provide your open session presentation, please? You just tap it. There you go.
Very gently.
All right. Thank you, managers. Wes Turkowski, Sendero Health Plans, Kelly Baronacci, CFO. And we have, we did bring another slide. All right, can we present the slides? Yeah, if we could share a slide just briefly, some late breaking news that we're excited about. And hopefully,
Yes.
you will be too. So yeah, just a minute at open and then we'll go and close. So tonight we're here with a preview of our budget. So this is a very rough first draft that we were able to put together. Is that us? Let's see.
Yes, but
We have not had time to review this with the Sendero board, so we'll review it tonight with you and then go back to the Sendero board for a few meetings and then return in a month or two for final approval. In the meantime, though, today CMS just announced the public star ratings for health plans. This is on the ACA individual market, and for the second year in a row, Sendero is the only 4-star plan in Texas, and still, yeah, the team is extremely excited about this because the competition is definitely getting a little more heated. Community Health Choice has come a long way. That's the Harris plan. It's been around 20 years, but big credit to them. It's a big plan, and they've definitely been making improvements. Blue Cross, of course, they should be 5-star. They don't have any excuses. Oscar and the rest of them, Oscar and the rest of them, working their way up. So we're very happy that we're able to serve Travis County with the best plan in Texas.
Highly qualified staff.
And a highly qualified staff, yeah, propping me up. I appreciate that. Yeah. And so the first, just a few quick, brief things. I don't have my reading glasses. Budget, I think I already discussed. This is our draft we'll be presenting in closed session tonight. We did just find out some market premium adjustments, and that enabled us to do a quick draft where we think we may be in terms of enrollment. And so that's why we haven't had time to share this with the Sendero board, but happy to walk through it in draft form tonight. The other thing that I'm happy to talk about in open session is there were some questions about the CHAP program. So you remember the CHAP expansion specifically, Central Health's Premium Assistance Program for high-risk people below 100% of the poverty level, mostly. This year, last year was 650 members approximately. And on average, each of those were 10 times the acuity of the average Texas adult, so very significant, tens, hundreds of thousands of dollars in care for each member. And one of the questions was, there were some people out of those 650 who received significantly less care, basically no care. And so what's going on with that? And the brief closed, we can talk about it a little bit more, but in open, I can talk about for any sample of members, even everybody in this room, you maybe all be the same health, but there's a normal distribution of utilization. Some people don't utilize anything, even though they should. Some people utilize a lot. So on our end as the payer, like our goal is trying to get as many people connected to at least one doctor's visit. And so as part of that, we can talk about the outreach that we did make to those people. And everything looks small. So of the few dozen members who had no claim, there was less than 24 members that had no claims or office visits, maybe a few prescriptions somehow. But there were 25 outreach attempts from the social workers, 43 attempts directly from case managers to these people, and 179 attempts from promotorists and community health workers to these households to try and get any kind of answer. And if we had time, I could bring them in to discuss. It's just as you might imagine, case by case. Everybody has, reasons or things happen. The good thing is that this is still a phenomenally low non-utilization rate. Usually you'd see 30, 40%, 20, 30, 40% non-utilization. So this 3-4% rate is significantly an accomplishment, but it's true. We're still focused on getting everybody. As part of that, we are happy that this year the letters included maybe a little more strong wording and encouragement to people that, look, it is kind of a partnership. You have an opportunity to get coverage. We'd like you to use it. And so hopefully that'll help this year too. And there's some other things we can talk about. And lastly, which I assume, depending on what we talk about, we can talk about next year, where I know there's a lot of ongoing conversations about what we can do to expand. And I think that was it for open.
Thank you, Wes. Appreciate that. I don't mean to displace you, but we're going to do all of our open session now, so we don't have to keep going back and forth.
Sure.
So if Stephanie can come up and present to us on agenda item number 6.
May I ask a question of Wes before he leaves, or do you want me to wait till after Stephanie has presented also?
Well, you can, I didn't realize, did you have your hand?
Yes, I have my hand up over here.
Manager Valadez.
Yes, Wes, thank you all. Thank you for your presentation. You said it was 3 to 4% non-utilization under the
Trying
chat
to do the math
program?
in my head, yeah, 2-3%.
2 or 3% of non-utilization. That was great. In light of the fact that ACA begins November 1st.
Correct. Oh, yes.
Next week, for 45 days until December the 15th. So in light of that fact, and in light of the fact that, it appeared as if there was a big support for expansion of CHAP under your program, I just asked, I don't think you were in the room, but I just asked whether or not, in light of the fact that we're going to have $9.4 million surplus in our contingency fund for this year, whether or not there would be a possibility for adding some of that, if not all of that money, to expanding the CHAP program, and whether or not you, as the executive director or CEO of Sendero, would have a problem with that. Would that be something that you could do? So that we can move forward on discussions?
We would be excited to expand at that level.
Thank you. Thank you for stating so. Thank you, Ms. And congratulations on your success.
Hi, Stephanie. Thank you.
Dr. Bell, thank
please
you.
go ahead.
Great. Well, I'm going to start, before we start our presentation, with just an update on the Brackenridge campus. It's really exciting. In September of 2022, we handed over Block 167 to the 2033 Higher Education Development Fund, which is per the terms of our agreement with them. And this really marks a culmination of a significant amount of work on the Brackenridge campus. And it includes the successful demolition of the former UMCB tower and a lot of infrastructure work. The rock, by the way, is still there.
But
I go chip off a part.
there is grass growing now per the code, the city requirements. And we expect to get our final letter of completion, essentially, the environmental clearance from the city of Austin any day now. Our partnership with the 2033 Higher Education Fund also yielded us a new Red River. When I say us, that is the community. That road is open. It's really exciting to drive down it. It's a great straight shot into downtown if you need one. And so with that, Dan, will you roll some beautiful drone footage for me? Our comms team has a lot of really creative folks, great tools, and they were able to do this for us. And I think it just helps you put into perspective blocks 167 and 165, as well as the significance of the work that we have just concluded. And I would be remiss if I didn't give kudos to our demolition contractor, J.R. Ramon, to Jeff, and to many people on that Central Health team over the years who have made this happen. Thank you, Dan.
Excellent.
Try this 3-minute shower routine to quickly get rid of toenail fungus.
And are you too bad? Great. But wait, there's more. But yes, there is. So Brianna, if you will bring up the presentation, you can go straight to the first slide for me, please. Yes, we are going to use that. Y'all were the grand premiere, but we will start using that in social media and some other things, and hopefully I can use it also. I mean, you know, we'll talk about Block 165 in the future, but it's exciting.
Red River? Yes,
Yeah.
it is.
Oh, it's open. Oh, yeah.
Yeah, it's open. You can drive down it now.
I now live there.
Oh, yeah, that's right.
I live in Brackenridge.
Oh, so I do want to give you some updates on some of our other active projects. The real estate component is really two functions. One is construction and development. The other one is kind of the real estate strategy piece. The Hornsby Bend Health and Wellness Center is, it is in active construction. We are really excited to work with our contractor IE2 on this project. And I think, we are currently on time and on schedule for a summer opening. And if you'll go to the next slide for me, here's just a picture of where we are at. Our communications team, in addition to being great at some media tools, also boots on the ground, the engagement folks went out yesterday, handed letters, delivered them into the neighborhood. We are going to have a very significant amount of work, including a concrete pour on November the 4th. We've had some, just concerns raised by the neighborhood, so we were proactive, getting out there, making sure that they knew they could text. There's a text message link to get updates from us, as well as just letting them know what was happening. That concrete pour is happening in the early morning, about 2 in the morning, just so that it's not impactful to the school and to the road. We are having to close the Sandifer Road frequently right now. And we just want to be respectful of the residents behind the Health and Wellness Center. One other picture, you kind of see them kind of blowing and going to the site, and there's the middle school across the street. Next slide, Del Valley. Del Valley is also in the active dirt moving phase. It is a little bit behind the Hornsby Bend schedule. We are still anticipating a fall opening of this site. I will let you know that, we are, there's some challenges, obviously the supply chain issues and some other issues that, we'll know a little bit more about this project in the coming weeks. In the next picture, you can see the site. If it had been level, I would have offered it for Circuit of the Americas parking, but instead it looks like a jump. Next slide, please. One of the projects that we've talked a lot about tonight has been, it's really cool, isn't it, Maram? Is the Rosewood Zaragoza Multi-Specialty Clinic. This was a very fast and furious repurpose of the existing Rosewood Clinic. It is a multi-specialty clinic, and you can learn way more from Alan Shalsha and John Morgan about the care that is being planned for this site. We have a demolition permit with the city. We met recently with Austin Public Health and the City of Austin Real Estate Division to make sure they're aware of our plans, since it is on their property, it is our property. We expect construction documents before Thanksgiving, and we hope that we will have a solicitation for a general contractor coming out very soon. And I do not want to take any thunder from John Morgan and his team. Margarito and Cynthia, who you saw earlier, Brittany, have been very, very critical to the success of this design. It is a whole interior gut, and we have a very, very efficient, we think, layout for the site. I cannot share with you from here the colors, but I think it was in the backup packet. There's cardiology, podiatry, gastroenterology, neurology, nephrology, and pulmonology, all co-located, nestled in the site, with a diagnostic suite, which I was talking to one of the nurses who is leading this effort for John's team, and she said this is really one of the only locations we have to do that diagnostics work right now for our patients. Next slide. So an update, we haven't forgotten about Hancock with all this other exciting work. One of the things that we are really working on is trying to cement with our partner, Community Care, what the clinical program is going to look like. Obviously, as you know, there's some impacts with I-35 to some of our existing sites that, really need us to advance the clinical care delivery at the Hancock Center. We are trying to develop that program. I hope after meeting today, David, that we've sent over a final version of a contract to the design team, the architects, engineers, and we hope that they'll sign that and we can maybe even be under contract by the end of this month. I'm always optimistic. But I think it's exciting. I will share with you a little bit more about this project in our closed session. And December 2025 is when we are anticipating currently that this would be open, or at least the administrative piece would be open. And with that, I'm happy to answer any questions.
Thank you, Stephanie. Any questions? Manager Allen.
Just one, and that was the concerns that somebody was having, that the community or someone was having with respect to the concrete pouring at 2:00 in the morning. Is that going to be a silent pouring?
It's not a silent pouring. That's part of the reason
I've
why
never heard of concrete pouring being silent with all the trucks going back and forth.
And so that is part of the reason.
Was that one of the reasons they were concerned?
Well, I mean, there is considerable noise. It is a construction site in their backyard. There is a buffer with some of the wooded area, but and we've been trying to engage them. I think the team the community engagement team have been very good about going out there and really meeting with people, contacting people directly. So we're trying, but it is an active construction site.
Thank you.
Thank you.
All right.
Thanks very much, Stephanie. Appreciate that information. It's great to see progress.
Well, we didn't have it before. Yes, great.
Okay, agenda item number 5, receive and discuss an update regarding Sendero Health Plans Incorporated, including an update on Central Health Premium Assistance Program, CHAP, and other subsidy programs, and B, a financial update. And agenda item 6, discuss Central Health owned and occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of Central Health Downtown Campus, administrative offices of Central Health Enterprise Partners, and new developments in eastern Travis County, deliberation and action on possible delegation to the president and CEO to purchase property. I now announce that the board is convening in closed session to discuss agenda item number 5 under the Texas Government Code, section 551.085, governing board of certain providers of healthcare services, and Texas Government Code 551.071, consultation with attorney, and agenda item 6 under Texas Government Code section 551.071, consultation with attorney, and Texas Government Code section 551.072, deliberation regarding real property. It is still October the 26th, and it is 7:50. Okay, it is October the 26th, 8:53 p.m. We are out of closed session, in closed session. No action is needed and no action was taken. Agenda item number 7, confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for Wednesday, November the 16th, 2022 at 5 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment.
Move adjournment.
I have a motion from Manager Greenberg, a second from Manager Valadez. Any further discussion? All in favor?
Aye.
Any opposed? Any abstaining? We are adjourned. Thank you, members. Appreciate it.